Coping with COVID and In It Together SC present Wellness Wednesday, brought to you by the Diabetes Action Council of South Carolina and DHEC's Division of Diabetes and Heart Disease Management.
Coping with COVID with Trey Taylor.
Happy Wednesday. Happy Wellness Wednesday. In It Together SC and the Diabetes Action Council of South Carolina present Wellness Wednesday every Wednesday here on Coping with COVID. I'm Trey Taylor. And today, Jane Kelly, Assistant Epidemiologist with SCDHEC, joins us for a COVID update. Lots of new information in the news about COVID. And Dr. Kelly joins us. I think she's there. Dr. Kelly joins us to give us some more information and to answer your questions. Thank you so much, Dr. Kelly, for joining us today. We appreciate it.
Thank you again for inviting me.
Absolutely. Lots of updates, and we'll get to Dr. Kelly in just a minute. But first, your COVID community updates. Former Richland 1 educator, Judge Mildred Weathers McDuffie, has passed away earlier this week. During her 34-year career in education, she became the first ombudsman and assistant to the superintendent, and in 1968 was one of 5 teachers selected to help communication to desegregate the school system. The active community leader also served as a summary court judge in magistrate court, and the City of Columbia dedicated the 100 block of King Street to Judge Mildred Weathers McDuffie. She was also inducted into the Richland 1 Hall of Fame. South Carolina lawmakers are rallying to pass the hate crime bill. This after it stalled in the Senate. The Clemente S. Pinckney bill would attach stricter penalties to violent crimes, including more jail time and higher fines. Most Democratic opposition says that the law is not needed, while some of the state's largest employers, including Walmart and IBM, say they fear not passing the bill would prevent companies from expanding in South Carolina. And don't let today's warm weather fool you. According to the groundhog, expect 6 more weeks of cold weather. Puxatony Phil saw his shadow, which means we will have to wait about a month and a half before spring officially arrives. In the last 136 years of predicting weather, Phil has predicted 100 winters and has been correct over 50% of the time. SCDHEC has your most up-to-date list of times, dates, and locations for COVID tests, COVID vaccinations, and also flu shots in and around South Carolina. Visit scdhec.gov for more information. Now, COVID vaccine and testing is also happening 7 days a week from 7 a.m. until 7 p.m. at Columbia Place Mall. You can stop by there and get, again, a vaccine or get a test. Also, COVID vaccines for veterans are being handled by the VA. If you are a veteran, please contact the VA for more information. Several retail outlets are offering the COVID vaccination, including CVS, including the CVS and Target stores, Kroger pharmacies, and also Walgreens. Now, Brooklyn Baptist Church also has a vaccine clinic that is open 7 days a week, Monday through Sunday. You can see that information on the screen. And if you are having a challenge, maybe getting to your COVID vaccine, don't miss your shot. You can catch a free ride on the Comet bus system and get your COVID vaccine. As a matter of fact, you can get your COVID vaccine at the Comet's main location in Columbia, South Carolina, at the corner of Sumter and Laurel Streets. Now, if you are having a challenge setting up an appointment, although most appointments now are walk-in, you can register at Get Set Up. Give them a call and they'll help you get registered for your COVID vaccine appointment. A couple of financial resources are still available, including FEMA. They are still doing their COVID funeral reimbursement. If you lost a loved one due to COVID, you can contact the information on the screen and they will help you get a reimbursement. Also, SC Bar Association and SC Legal Services has a toll-free number and website for rental and mortgage help. Lexington County has a bill assistance program. SC Housing and Dominion Energy have collaborated on a rental and utilities assistance program. SC Housing also has a frontline workers home buying program, and SC Hopes has a 24-hour assistance line. If you or someone you know is having a challenge coping with COVID, please contact the folks at SC Department of Mental Health. Lastly, it is Heart Health Month, and we're going to talk with the folks from Prisma Health and the folks with the American Heart Association next Wellness Wednesday. But Prisma Health has a series of seminars and webinars that they are doing this month for Heart Health Month. If you want more information, you can go to prismahealth.org/hearthealth for more information. You can actually see that information on the screen. I'm Trey Taylor, and you are watching Wellness Wednesday. In It Together SC and the Diabetes Action Council of South Carolina present Wellness Wednesday every Wednesday here on Coping with COVID. If you would love to check us out, we would love for you to do that. We are streaming live on the In It Together Facebook page. Please go over there, hit like and share and follow. Man, I tell you, they've got lots of great information on that In It Together Facebook page and website, but you can also check out Wellness Wednesday and also all of the other great information. We're also streaming live on the TaylorMade production page. Would you please go over there and hit like and share and follow? Not only will you get notifications as to when to watch Coping with COVID, Wednesday, Thursday, and Friday, and first Monday with comedian George Wallace, you'll also get all of your COVID-related updates. We're streaming live also on the YouTube channel. Please go over there and hit the subscribe button. Listen, if you want to check out some past episodes of Coping with COVID, that's the place to do it, because all of the previous Coping with COVID episodes are right there on the YouTube channel. Don't forget that scrolling at the bottom of the screen, as you can see, all of the information that I just shared, the testing information, the vaccine information, all of the financial information, all of that, and so much more will be scrolling at the bottom of the screen. So please go over there, hit post and share, and get the information that you need. I want to say hi to everyone watching. Who is this? Mitchell Peace Joy Jen says hello. Want to say hello to you, beautiful. Also, Adam Chappell wants to give us a shout out. Hey there. I think it's Adam Shapiro is watching. Want to encourage you to post this information out so we can get the message to the masses. Dr. Jane Kelly is here with SCDHEC, and I know that you may have some COVID questions. Well, she is here to answer them. There's lots of new information on COVID, vaccines, testing, and more. Dr. Jane Kelly, as I said, assistant epidemiologist with SCDHEC, joins us because there are a lot of updates. Dr. Kelly, thank you again so much for joining us today. We appreciate you.
Oh, I'm glad to be here. There is a lot going on.
Yeah, there really is. I want to say hi to Cynthia Watson. Let's first get an update. Let's talk about current numbers of COVID.
The current numbers are pretty disturbing. I mean,
Wow.
If we look at just this past weekend, the weekend of that ended January 31st, over 25,000 new cases in South Carolina and over 200 deaths from COVID-19 in South Carolina.
25,000.
Yes, a huge peak, huge surge. I mean, we always expected a surge after the Christmas, New Year's holidays, but that with the double whammy of Omicron, the variant that is more contagious, we had an unbelievable surge. It certainly exceeded anything we'd ever seen before.
Wow.
The good news is it does look like it's beginning to trend downward, but you have to be a little careful when you say that out loud, because a trend over a few days does not mean the season is over yet.
Why do you think last week? Because like you said, usually when it's a holiday weekend, when people are gathering, we see the uptick. But what was the holiday last weekend?
No, well, remember, you'll see an uptick 2 weeks after an event, and that would be an increase in cases. And we did have a huge increase in cases in the middle of January as well. It's just we're still at that incredibly high level. And that's because Omicron is so contagious. And of course, the increase in deaths comes 2 weeks later after the increase in cases, because most people don't die in the first week. They die after they get severe illness, usually more than a week, maybe 2 weeks after getting COVID-19. And then, they're admitted to the hospital in intensive care. It takes a little while before there's a lag time before we see that increase in deaths after increase in cases.
Right. All right. So 25,000 new cases, 200 deaths. What about hospitalizations?
I don't have that off the top of my head.
Okay.
But I can say this, we are at the highest number of people hospitalized for COVID ever in the United States right now.
Wow. Dr. Jane Kelly joins us. She is assistant epidemiologist with SCDHEC. We're getting your COVID update today on a Wellness Wednesday from In It Together SC and the Diabetes Action Council of South Carolina. What about this new variant? I mean, now we know about Omicron, and as you just mentioned, it's more contagious. It's highly contagious. So regular COVID is out there. The Delta is out there. Omicron is out there. And now this new stealth Omicron. What's that?
Yeah, I hate that the media are calling it the stealth Omicron, because that sounds like, oh, you won't be able to find it on a test.
Right.
If you have symptoms of COVID and you have that particular variant, your test will still turn positive. The trick is with the original Omicron, with what is called BA1, Omicron, it is detectable even by a regular PCR swab, the nasal swab. And when I mean detectable, I mean that the way it turns positive on the test in the laboratory, they can tell, oh, I know what variant this is. This is Omicron, because it looks different than the Delta variant on the actual PCR test. Doesn't mean that your test won't turn positive with the stealth variant. The stealth variant should really be called BA2. It's like a sister to the original Omicron. It's not that different, but it's got a couple of tweaks that make it not show up in that same way in the laboratory, that you can tell right away that it's, this particular variant. They have to do an additional test.
Gotcha. So what is the difference? I mean, is it work? Because we know that the Omicron is highly contagious. Is this even more contagious, or are there other differences?
Well, it looks like it's at least as contagious. There's sort of mixed information out there, because it's always hard to tell how much is the biology of a variant making it more contagious, or how much are people's behaviors making it spread more easily. We really are not seeing cases of it here in the United States very much yet. There are a few here and there, but if we look to some other countries, for example, Denmark is seeing an increase in this particular variant. Denmark's very different from the United States, right? Most of its population, far and away, most of its population are vaccinated. And that has served them well to protect them against a lot of different variants, against Delta variant, against Omicron variant. This variant is maybe a little bit better at escaping immunity. That doesn't mean that vaccines don't work. Vaccines do work in preventing severe disease, but might be a little bit better at causing an infection. All the information isn't out yet about that. There are studies just coming out with this. Is all brand new information.
Right. Dr. Jane Kelly joins us. She is an assistant epidemiologist with SCDHEC. We're giving you a COVID update. We've got a couple of questions, Dr. Kelly, so I want to stop for a second to answer some of these questions. Janae Bright says, when someone tests positive for COVID, is there a prescription protocol that doctors should follow? My husband and I tested positive at different urgent cares. I was given a prescription and he was not. Thank you for your question. What do you think, Dr. Kelly?
There are certainly recommendations. So when we talk about a protocol, there's not something written in stone, this is what you must do. It's individual provider decisions, but there's certainly recommendations that have been made by CDC, NIH, and even within South Carolina, the South Carolina Medical Association, South Carolina Hospital Association, and a number of other organizations came together to make some specific recommendations about treatment. It may be for this individual that it may be different doctors looking at this differently in terms of their judgment call. It may be the availability of medications, or it may be because this person and her husband have different medical conditions that warrant different treatment. For example, there are 2 new pills out there, Paxlovid and Molnupiravir, which can be given to someone who has immunocompromised or has severe medical conditions or is very elderly and therefore at great risk of going on to have severe COVID. Those pills, however, have to be started within the first 5 days of testing positive. Wow. So I could see one person might get a prescription because they've got multiple medical complications and they were just diagnosed. Yeah. Another person might not because they got tested, but they've been sick for 5 days already. And, they're sort of out of that therapeutic window, that time period where those pills would help them.
Right. Danae, thank you so much for asking your question. I see you have another question, but we're going to come back to her question in just a minute. Cynthia Watson, thank you so much for your question. I see your question. I'm going to come to you in just a moment too. But I was thinking that too, Dr. Kelly, I was thinking that maybe, well, she said her husband got it first and then she got it. Maybe she was further along in her diagnosis or in her condition or whatever, you know what I mean?
Or the other way around. He gets diagnosed first. He's had it for a while. And then she's newly exposed. She gets diagnosed very early on in her infection at a time when pills would work. We also have to be honest with the fact that the supplies of these medications are very limited. And that's not unique to South Carolina. You know, the pharmaceutical companies are trying to make these pills and get them shipped out as quickly as possible, but it takes some time. So sometimes these medications are not readily available. There might be a week where the pharmacy has just literally run out of supplies until they get their new shipment next week. There's not much they can do.
Yeah. In It Together SC and the Diabetes Action Council of South Carolina present Wellness Wednesday every Wednesday here on Coping with COVID. Dr. Jane Kelly, Assistant Epidemiologist with SCDHEC, joins us. Cynthia Watson has a question. She says her 18-year-old nephew just tested positive for COVID over the weekend. She says he's vaccinated and boosted. He has very mild symptoms, mostly fatigue. Once he tests negative to return back to school, will he have higher antibodies to prevent infection again? Thank you, Cynthia, for your question.
Absolutely. Thank you, because you bring up a number of important issues we should talk about. Number one, I'm so glad to hear that your nephew was vaccinated and boosted. And boosted, yes, because people are thinking, well, 2 should be good enough, right? We know with the studies not only coming out in the United States, but in countries that are kind of ahead of us in this pandemic, like Israel, they started vaccinating and boosting earlier, or countries like South Africa that had earlier experience with Omicron. We know from their experience that the booster is very important, especially with this new variant. Now, again, the importance of vaccination and booster is not to prevent mild infections, to prevent severe infection. So I'm sorry that your nephew is not feeling well, but I am confident that the vaccine and booster helped him out with giving him milder symptoms and preventing severe disease. He should not have to test again to go back to school. If you do a PCR test, the nasal swab test that they run in the laboratory, some people have a persistent positive, even though they're not contagious. The test can stay positive for several weeks because it's just picking up fragments, little pieces of the virus.
But they're not contagious.
But they're not contagious. So, I would hate to see him get tested again and I have no symptoms, I feel fine, I have no fever, and yet it's positive. What's going on? He should not get a PCR test. If the school is requiring retesting, that's not what we at DHEC or at CDC recommend. We recommend against that. But certainly if he had a test, the only test I would even consider doing would be the rapid test, the antigen test. Okay. But in answer to your last question, will he have higher antibodies? The people who are most protected from getting reinfected with COVID are people who have been fully vaccinated and boosted and infected. Now, we're not recommending anybody go out there to get deliberately infected. That would make no sense at all. But he is among the most strongly immunized against COVID-19 because he's vaccinated, boosted, and he had that breakthrough infection. So that's the silver lining to his illness.
Yeah. Thank you, Cynthia, so much for your question. She says, thanks, Dr. Kelly, for the clarification. Janae, I see your other question. I'm going to come back to your question in just a minute. We're talking to Dr. Jane Kelly. She is Assistant Epidemiologist with SCDHEC. I'm Trey Taylor, and you're watching Coping with COVID. And Wellness Wednesday is brought to you by SCDHEC, the In It Together SC, and the Diabetes Action Council of South Carolina. Let's talk a little bit about types of tests, since you mentioned that. Dr. Kelly, what other types of tests? You mentioned that we know there's a rapid test and then there's a PCR test. There's all kinds of tests. Give us the distinction between the tests and the accuracy of each of them.
Sure. The gold standard, and by that I mean the test that is the most accurate, highest sensitivity, meaning it'll pick it up if it's there, and specificity, meaning that you won't get a false positive are the PCR tests. So the PCR tests are the ones where you either spit in a container or it's a nasal swab or a mouth swab, but it's got to go to a laboratory. And that means a delay in finding out the answer. And that's what led to the rise of these rapid antigen tests. What those do is they look for a protein, the protein coat of the virus. And so the virus has got to be there in a high enough amount for the test to pick it up. But the advantage, the beauty of the rapid test is right there in its name. You get an answer rapidly. Within 15, 20 minutes, you have an answer. How accurate are they? It depends. So number one, of course, any test, it depends upon the person doing the test. If they get an adequate sample, don't be squeamish. You need to really, swab both nostrils. So was it an adequate test? Does the person know what they're doing? If you're doing a home test, make sure that you follow those instructions precisely to make sure that you get an accurate answer. But done by someone who is competent in doing this test and getting an adequate sample. The Binex Now test kits, for example, are 92% sensitive, which means that 92% of the time they will pick up that positive test. So if the test turns out to be positive and you have symptoms, I think you should hang your hat on it. It's COVID. It's very rare, especially now with such high community spread, that would be a false positive.
Right.
But let's flip that around.
Okay.
Because if you had symptoms and you did a test and a rapid and it was negative, I wouldn't entirely trust it because they do have some false negatives. That's the disadvantage of the rapid. So if you have symptoms, you do the test, it's negative, I'd still get that PCR to be sure.
Okay. All right. And those home tests, how accurate are they? And I know you say it really depends on user. If as the user, as the person administering it, if you're, I guess, really going up in there or whatever, is that?
Well, and you don't have to go way up in there and do a brain biopsy. But seriously, people need to not be squeamish. You only need to insert that Q-tip swab about a half an inch into your nose, but to really rotate around so you get a good sample and to do both nostrils. You really need a good sample.
Yeah.
So let's say you do a good sample. It's an at-home test. You followed all the directions. That at-home test wasn't sitting, in the car on a hot summer day or something that is going to ruin it. Use your common sense. Those tests are really very accurate. And specifically the tests that were being sent out by the federal government and the tests that you can get through DHEC are very accurate types of at-home tests. And so just to reiterate that you can get free tests. You can get four free tests through covidtests.gov.
I ordered mine.
I ordered mine as well, covidtests.gov. But you can also get free tests through DHEC. Now, they won't mail it to you. You have to go to your local health department. DHEC has ordered almost 2 million at-home tests and test kits. And remember, each kit comes with 2 tests. So you can visit the health department, get one of your free at-home test kits with 2 tests while supplies last. Now, of course, we've ordered 2 million. We don't have 2 million on hand right now, but we have tens of thousands of tests, and we should have that number by the end of this month.
Yeah. Cynthia says she ordered hers. She's yet to receive hers. Me either, Cynthia, but I've found, some people have. Okay. So you can, of course, and we're going to get put that information on the screen. I think we've been talking about that anyway, that people can mail, go and, online to get their tests. And then DHEC has tests. Where can people get those tests from DHEC? From the health departments?
Yes, you go to your local health department, and you might want to call them ahead of time, since right now the number of tests are limited, just to make sure they haven't run out of their supply.
Right.
But we'll be getting new supplies every week.
And those tests from DHEC, because I went and got some from the Lexington Health Department, you have to mail them out, right?
Yes, you have to mail them out. There are some other
to get your results.
I do want to mention one additional way of getting test results, and that is programs that we're doing in schools. We also have rapid antigen tests available for free for school use. So that could be the school nurse doing diagnostic testing, testing a child who is sick, but also doing screening testing or doing something called test to stay. That is if a child has been exposed to COVID but they want to stay in-person schooling, in-person learning, that they could be tested on day 5 after their exposure in school with those rapid tests. We have free tests available for the schools, including opportunities where they could just contract with a vendor to come and do the testing. So the burden wouldn't be all on the school nurse.
Right. Yeah, the Test to Stay program, I was going to mention that, the Test to Stay program. We can talk a little bit more about that after the break. But I want to go to Danae's question. She wants to know who's eligible for antibodies.
So monoclonal antibodies are a treatment that a person can receive who is at severe risk of going on to have severe COVID. But there are some caveats. There are some exceptions. Before Omicron, we had a lot of different types of monoclonal antibody products that were available, and we had an abundance of it, so that most people, if they became infected with COVID-19, could go to a local hospital or infusion center, because this has to be given IV or as a series of shots, and get those monoclonal antibodies. The problem is Omicron is resistant to the 2 most common brands. So the game has changed so that we have a limited amount of another kind of monoclonal antibody called sotrovimab. It's a limited amount of it right now. Hopefully this will increase with time. But because of a limited amount, we have to use it for the people who need it the most. Those are people who are immunocompromised, like cancer, and they're on chemotherapy, or they've had an organ transplant and they're on powerful medicines to suppress their immune system. There is a list of recommendations that have been made by organizations such as the South Carolina Medical Association, and a letter has gone out from DHEC to medical providers throughout the state, making recommendations about who would benefit the most from those monoclonal antibodies. So they're not as freely available for everyone right now, just because we're trying to make sure that we reserve that limited supply for the people who need it the most.
All right, Danae, thank you so much for your question. Dr. Kelly, thank you so much for your answer. We are talking to Dr. Jane Kelly, Assistant Epidemiologist with SCDHEC. I'm Trey Taylor, and you're watching Wellness Wednesday from In It Together SC and the Diabetes Action Council of South Carolina. She is giving us our COVID update. If you are just joining us, please hit the replay button, because, gosh, we've been talking about so many things you need to know about as the COVID virus continues to wreak havoc, and the game continues to change, Dr. Kelly. I mean, you miss a day, you miss an update with this,
We do have some good news. Moderna vaccine.
Let's end the break with some good news, and then we'll come back and talk about kids. Go ahead.
Well, the Moderna vaccine was just recently approved, given full approval by the Food and Drug Administrations. Now we have 2 vaccines, Pfizer and Moderna, both have their full approval. And I think that relieves a lot of people who were concerned about, not sure, why is it out there only as, and under this emergency use authorization. It's gone through the full process and had the full review at this point in time. So that is very good news.
Yeah. So when that happens, when they were granted emergency, it just meant what? That the FDA had not gone through the entire process, but just enough to say, okay, it's good for right now. And then here's the thing: what would have happened if the FDA says, "Oh no, now we've finished with our full evaluation, we're not giving you full approval"? What happens to those folks walking around with the Moderna vaccine?
That has happened with some medications and in other circumstances. So that was always a possibility. But let's talk about the difference between that EUA and what happens with full authorization, because the difference is really a matter of time and how much information over time is collected. So for all the vaccines that were released, they had to prove that the vaccine worked. And I don't mean just looking in laboratory test tubes. They had to prove in real life that the people who got the placebo were statistically more likely to get COVID-19 disease than the people who got vaccine. So we clearly knew those vaccines worked. What we were waiting on was making sure that they were safe. We have these are new vaccines, but we have more than 100 years experience with vaccines in general. If you look back to smallpox vaccine. And what we have learned with those other vaccines is that most people, if they're going to have a serious side effect from a vaccine, it will happen in the first 6 weeks. So using that, FDA said, all right, vaccine companies, you need to send us at least 2 months worth of safety data. After somebody's fully vaccinated, we want you to follow them for at least 2 months and have all that information to show us whether they had any bad events. Then we'll consider an EUA. To get full approval, you need a much longer period of time of data. You need 6 months to a year's worth of data. So that's why it took so much longer to get that full approval. During that period of time, though, we have had almost 600 million doses of vaccine given out in this country alone. And really just a handful of unfortunate complications, but just a handful. So the safety data is now crystal clear for both of these vaccines.
Right. Dr. Jan Kelly joins us from SCDHEC. She's the assistant epidemiologist there. I'm Trey Taylor, and you're watching Coping with COVID. It's Wellness Wednesday, and it's brought to you by the Diabetes Action Council and In It Together SC. When we come back with Dr. Kelly, we're going to talk about COVID shots for kids under 5 years old. That's been in the news frequently the last couple of days. We're going to talk to her about that and also about long COVID. Have you heard about that? We're going to talk to Dr. Kelly about that. And then finally, any other masking and social distancing updates. Plus, Cynthia, I see you have another question and any more of your questions. Hey, don't forget to post and share this information out. Great information Dr. Kelly is sharing with us today on the COVID-19, 20 and 22 virus. And we're going to talk more about it coming up next on Coping. I'm Trey Taylor. We'll be right back.
Hi, I'm Kimberly Aiken-Cochran. As Miss America, I know that taking care of yourself is important. Part of taking care of your health is knowing if you're at risk of type 2 diabetes. Prediabetes is serious and puts you at risk for developing type 2 diabetes. 90% of South Carolinians who have it don't know they have it. Visit inittogethersc.org. Take an online test to find out your risk and join a diabetes prevention program. Brought to you by the Diabetes Action Council of South Carolina.
Computers, they're a part of our everyday lives. But when they're not working, they're an everyday problem. So call Computers Unique, your everyday solution. 803-351-5821. Is your computer running slow? Won't turn on? Do you need a screen replaced? Or maybe you just need another computer? Well, Computers Unique is your one-stop shop for all your computer needs. They have a wide variety of new and pre-owned PCs, Macs, and tablets. So call Computers Unique, Dutch Square Mall. 803-351-5821. 803-351-5821.
The Comet gives me a reliable source of transportation.
It's very convenient to me, and they have wonderful drivers.
It's clean, and it builds community. It's fun to meet people.
It makes me feel like really independent. It's just fun.
It's always going to be there, and it gets me everywhere I need to go.
We try to ride every single day. Comedy is our livelihood.
Hey there, I'm Trey Taylor. Thank you so much for joining us. You're watching Wellness Wednesday on Coping with COVID. It's from In It Together SC and the Diabetes Action Council of South Carolina. Listen, we are actually streaming live on the In It Together Facebook page. Please go over there, hit like and share and follow. Man, I tell you, they've got some great information on the In It Together Facebook page about diabetes prevention, programs about living, eating, and being well and healthy. You can find so many great tips over there on Facebook, on the In It Together Facebook page, and also on their website. We're also streaming live on the Tailor Made Production page on Facebook. That's the home of Coping with COVID. Please go over there also, hit like and share and follow. Not only will you receive notifications as to when to check out Coping with COVID, Wednesday, Thursday, and Friday at 2 p.m. Eastern Standard Time. And then first Monday with comedian George Wallace. We also streaming live on YouTube. Please go over there, check that out. Please hit the subscribe button and listen if you want to check out any past episodes of Coping with COVID. That's the place to do it on the Coping with COVID Trey Taylor YouTube channel. We also have a presence on Instagram. We've been talking to Dr. Jane Kelly. She is the assistant epidemiologist with SCDHEC. She is giving us our COVID update. I tell you, if you have just joined us, please hit the replay button because she's been sharing such great information. I also want to remind you that scrolling at the bottom of the screen, all types of great information concerning COVID, including testing sites, vaccination sites, times, dates, locations, also so many great financial resources if you need rental or mortgage help or also financial assistance, all of that and so much more scrolling at the bottom of the screen. So please continue to check that out. Dr. Jane Kelly, we have heard in the last couple of days about COVID shots for kids under 5 years old. You know, parents, and I have a little one that's 3 and in daycare. And, because those children are not vaccinated, they're very susceptible. A lot of people are saying they even have a lot of problems with kids wearing masks. She wears her mask because they grew up wearing masks. That's the first thing.
Yeah.
But, what's the update on vaccinating kids under 5 years old?
Well, I know Pfizer has announced that they plan to submit their application for EUA for vaccine under age 5. Mm-hmm. And that process can be a little bit streamlined because they can submit an amendment to their original EUA. But it seems a little premature to be talking about those vaccines being available. I've heard some places saying available by the end of this month. I find it hard to believe it'll go quite that quickly, right. But maybe by mid-March, it's possible.
Is it something that, and at least it seems like Pfizer is always the first one out of the gate, but do you think maybe these vaccines for kids 5 and under, I would think they would have been testing this the whole time. When you start testing vaccines, and obviously you know better than I would, do you just test, okay, we'll do adult tests first, and then we'll do, younger kids test first, and then the little ones get their tested last?
Yeah, actually, that is the usual process, that you would test a vaccine first or any medication for that matter. You would test first in, young, healthy adults with no medical problems, looking for any safety concerns. And of course, that's only after you've tested it in animals, in primates, monkeys, so that you know that there are no safety concerns for them before you would do any human testing. But the usual process is to test something in adults, get it approved in adults, and then move down the line to younger age groups. So, that process is not different here.
Right. Okay. So you're thinking, they definitely are testing for kids under 5 years old, and they're saying it's just a low dose it's a lower dose of the vaccine for kids 5 through 12, right?
That's right. So, for example, for the age group of 11 through 17, they tested them with several different doses. They tested them with 10, 20, and 30 micrograms. And 30 is the adult dose. So for that age group, they tried them. Excuse me, I misspoke. I meant 5 through 11.
You said that. You said 5 through 11.
Okay. Okay. 5 through 11. They tested them with 3 different doses, and their plan was to go with the lowest dose that still gave a good immune response. And that's a pretty reasonable approach, to go with the lowest dose. You figure that's going to be the safest dose. And what they found for that age group was that 10 micrograms worked just fine. So that's what children ages 5 through 11 get. For under age 5, they tried different doses. They tried 3, 5, and 10. And they thought at first, let's go with the 3 micrograms. Let's go with the lowest dose possible. And what they found was it worked very well for ages 0 through 2, but not for kids between 3 and 4. And so it sort of reset their plans with how they were going to analyze the data. They had to go out and test more children, or they would have been ready earlier for submitting that EUA.
Mm-hmm. Okay.
So we do already have a lot of data on safety and effectiveness, the evidence that the vaccine does work, evidence that it is safe, but FDA wants more.
Right. Cynthia Watson had a couple of questions. She wants to know, are you finding that most hospitalizations are those unvaccinated?
Far and away, they are among people who are unvaccinated. And that really goes for the kids. If you look at hospitalizations right now among children, ages 5 and up, children who could have been vaccinated, almost 100% of the ones who are hospitalized and in the intensive care unit are unvaccinated. Certainly, there's a surge of cases among people who are vaccinated, as well as a surge among unvaccinated, but it's much higher among the unvaccinated. And if we're talking about severe disease for adults, adolescents, children, the vast majority of people in hospitals are unvaccinated or perhaps partially vaccinated with just 1 dose of vaccine.
Right. And I think we're seeing that, right, Dr. Kelly, because I keep hearing numbers of people who are partially vaccinated, have gotten that 1 shot, but not gotten the 2nd shot.
Yeah, it has to do with how your immune system works. It really is like a training, that you expose your immune system to the spike protein, because that's how most of the vaccines for COVID are based. You expose your immune system that one time, it starts making antibodies, it starts making cells called memory cells. But it really needs that additional exposure, a reminder of, hey, this is important. You need to remember this spike protein. You really need those at least 2 doses, and in this case, a booster. That's true with a lot of other vaccines as well.
Right. Yeah.
You wouldn't just get 1 dose of the tetanus vaccine as an infant and never get it again, because that's not how your immune system works. Your immune system every day is paying attention to so many things, right? Every day you're exposed to, not just infections, you're exposed to, dust mites, and you're exposed to, all sorts of different materials that your immune system is going to respond to, mold. And so it needs reminders about what's most important. And this is one you want your immune system to remember.
Right. Do you think, Dr. Kelly, that we will come to a time where, and a lot of people, a lot of countries are just going with, okay, this is COVID. This is going to be here to stay. We need to go about our lives. So mask or don't mask, just social distance or don't social distance, vaccinate or don't vaccinate, but go about your life knowing that just like a cold, a flu, measles, mumps, whatever, pink eye, it's out there and you may get it.
We have to strike a balance between public health, risk to people, and societal needs. Kids need to be back in school, and in-person school. People need to be back at work. People need social context, to be together with friends, family, with others. But we want to make it as safe as possible to do so. How can we do that? Well, number 1, vaccinate the most vulnerable. And we've done that, right? We have vaccinated the elderly, many people with chronic medical problems, people in nursing homes, people who are most at risk. Many of them are fully vaccinated. Many of them are vaccinated and boosted. That's great. But we've got lots more work yet to do. I keep returning to vaccines because, to my mind, that's the greatest solution for several reasons. Number 1, it's simple. Once it's done, it's done. I think people have been disappointed when boosters came out, feeling like, oh, what are we going to do? Are we going to need boosters every 6 months? Probably not. Most vaccines, I can't think of any vaccine that you boost every 6 months.
Every
granted,
year?
granted, you get the flu vaccine is different every year. And so I think no one can predict the future to say for sure how often one might need a booster for COVID. Mm-hmm. But it's, to me, my mind, a simple solution. Whereas, for example, the question earlier about monoclonal antibodies, once you get monoclonal antibodies, that's great for right now. That helps you for right now. But it's not a permanent fix. It's only going to be good for protecting you for the next 3 months. So it's just a stopgap measure. The same thing with these new pills. New pills are great if somebody has contracted COVID and they're at risk. They can take these new pills that'll help prevent them from getting severe disease. But, it's only for that one time that they're going to protect you. Mm-hmm. Whereas vaccination will protect you over the long haul.
Right. So you do think, just your personal opinion, your medical opinion, as far as COVID is concerned, we will continue to have to get boosters. You say, of course, not every 6 months, but maybe annual.
I don't want to overstep the science here. No one knows the answer to that question yet. I think it's a good bet that we will not need these constant boosters all the time. This is a new phenomenon because it is a new disease. No one has had this disease before. This is brand new to the world.
Yeah.
So no one had any pre-existing immunity. So, we have a lot of catch up that we need to do to make sure everybody's got that immunity. But once enough people have that immunity, the situation changes. So I don't mean to imply, we're going to need to get boosters. In fact, I'm saying the opposite, that I think eventually we will reach some sort of balance, some sort of equilibrium where most people will either be vaccinated or they will have some immunity because they've had COVID once, twice, maybe more. Or they've both been vaccinated and had COVID. I think eventually this will start to become sort of a balanced act. Yeah. And that I know some other countries are trying to return to normal. So are we in the United States, changing our recommendations about guidance for schools and returning to work. That's trying to embrace a different amount of risk, that we're a little bit more risk tolerant because we've got the most vulnerable people, more of them vaccinated.
Right. Cynthia Watson says, great trust question, Trey. She says, that's been my concern as well. She said she's not contracted COVID. Me either. She said, but it seems inevitable that at some point it's likely to happen. She said, there's so much COVID fatigue in our country, and there is. Will we use mitigation protocols forever? Thank you for your question. I think you've already answered it.
I know some experts have said that they suspect everyone will eventually get COVID. I don't know that I would necessarily say that. Right now we're at very high community spread. So if you're out and about right now, you're at pretty high risk of contracting COVID. But if it continues to go down, where will we be several months from now with more people vaccinated and more people who have had COVID and now have some prior immunity? We won't have as much community transmission.
Yeah. One more question, then I'm going to ask my final question and let you go back to doing doctor work. Mitchell Peace Joy Jen wants to know, does blood type play a role in the severity of a person's COVID symptoms? Thank you, Mitchell.
There does seem to be some science to that blood type, different blood types seem to correlate with less severe or more severe symptoms. But I feel like that's a really rough measure. It probably is just reflecting some other genetic factors. Some people are more prone to developing severe disease. It can be because of medical problems that they know about, or medical problems that they don't know about. People have different amounts of innate immunity. How some people just get lots and lots of colds over and over again, and other people just never seem to get sick. That's the same sort of thing. So there is some evidence around blood type, but I wouldn't feel protected because I had one blood type or another.
Yeah. Dr. Kelly, what's long COVID? Thank you, Mitchell. What's long COVID? I've read some reports about long COVID. Is that when you've had it a long time?
The term long COVID is kind of a nickname for a post-infectious, after you've been infected, sequelae, meaning symptoms that hang on and hang on and hang on. And to meet the definition, they have to be symptoms that last at least 4 weeks after your initial infection. And the trick with long COVID is your initial infection might not have been all that bad. You don't have to have severe symptoms. You might have had mild COVID, but then it keeps dragging out and dragging out. And the most prominent symptoms that people report is fatigue, and sometimes really extreme fatigue, where they have to take to bed, where they're really not able to do much at all. Other prominent symptoms are aching all over, trouble concentrating. Some people use the term brain fog, that they just have trouble focusing on things. And that especially worries me about, people who are working, kids who are in school, how are they managing? And the other symptom that seems to last a long time is insomnia, having difficulty sleeping.
Wow, sleeping. Mm-hmm. Wow. So that's long COVID when you have
there really has not been an effective treatment found for long COVID. There are studies going on, and there are different recommendations, and there are physical medicine and rehabilitation clinics. There are clinics in South Carolina where you can go and get some advice about how to cope with your long COVID. But I think this is a good case of an ounce of prevention is worth a pound of cure. There is evidence that being vaccinated can help prevent long COVID. And there's even evidence that if you have long COVID and you then get vaccinated, that your symptoms will lessen.
Wow. Dr. Jane Kelly with SCDHEC, she's the state assistant epidemiologist, has joined us. Cynthia says you've been a phenomenal and informative guest, and I agree. And thank you so much always for agreeing to come on and educate and inform us. Anything you want to share in closing, Dr. Kelly?
Yeah, I do want to mention a little bit more about pediatrics, because I know I've had people say to me, vaccine for under 5, I'm not so sure about that. And I can certainly understand anytime something is new, people are hesitant. And so you have to, from my point of view, I look at the data. I look at what do we know about this vaccine? We know that it is, safe and highly effective in older age groups. How different would it be in children? Well, I would be looking for what the dose is and what safety information that Pfizer provides. But there's another piece to the story I look at, and I look at what's the downside of not getting vaccinated. And it is true, most children have mild disease and it's not a big deal. But unfortunately, the number of children who get serious disease and hospitalized is not zero. In this country, we have had to date over 36,000 children hospitalized with COVID-19, and 807 have died. 800 children have died of COVID. And, they're not all children who have other severe medical problems. About 30% of those children who died were children who had no known other medical problem. So I know that's a small number, but it's not a zero number. And again, this is a vaccine preventable diseases. I look to my colleagues, my friends who are physicians or who are scientists who have children who are between 5 and 11, and they rushed out to get their children vaccinated. They voted with their feet. So I would urge parents of children who are unvaccinated to get the facts. Don't rely on what you read on social media. Get information from your healthcare provider, from your pediatrician. Look to the DHEC website. Look at the CDC website. If you don't like government website, look at a School of Public Health website. Go to Morehouse School of Medicine. Find another School of Medicine, Emory University, someplace that you feel that you trust the information coming out of them. And often they also have a contact us where you can submit a question.
Whatever you do, like you said, just go to a reputable source to get your information. And Dr. Kelly, you certainly are that. Thank you again so much for joining us today. Thank you for the information. And thank you for always saying yes when I call on you and ask you to come on and do the show. I appreciate you and all of the work that you're doing in our community. Dr. Jane Kelly, Assistant Epidemiologist with the state of South Carolina. Thank you so much.
Thank you.
Absolutely. Hey, don't forget to post and share this interview out so we can get the message to the masses. And please, if you're just joining us, hit the replay button. Now, if you have a story or initiative that could help someone cope with COVID, please email booking@copingwithtreytaylor.com. That information should be scrolling at the bottom of the screen. Booking@copingwithtreytaylor.com. If you have a product or service that could help someone cope with COVID, please email copingwithtreytaylor@gmail.com. copingwithtreytaylor@gmail.com. We would love for you to be a proud sponsor, just like SCDHEC, In It Together SC, and the Diabetes Action Council, who sponsor Wellness Wednesday. Javis Tax Services, also Palmetto Painting, the Fifth Circuit Solicitor's Office, Attorney Byron Gibson. He comes on every second Thursday. Palmetto Media Connections, Agape Counseling and Training Services, Black Expo, the Comet Bus System, and also Computers Unique, Dutch Square Mall. Hey, Cynthia, I heard you say that you got your computer from Computers Unique in Dutch Square Mall. And yes, he has been a sponsor and a supporter for years and years and years. So we really appreciate Daniel over at Computers Unique in Dutch Square Mall. Coming up tomorrow, why are we still talking about voting rights? Why is that still important? I thought people suffered, bled, and died for that. Well, they did, and we still got to talk about it. Holly Holiday with Sister Lead, Sister Vote joins us tomorrow. And Janice Mathis, who is a lawyer, radio host, and executive director of the National Council of Negro Women. Both of those ladies will join us tomorrow to talk about why voting rights is still something we need to talk about today. And then the SC Freedom Walk, Ahmad Ward will join us Friday to tell us what that's all about. That and more coming up this week on Coping with COVID. As usual, I leave you with a spiritual reading. I've been reading from Dr. Cheryl Williams' Conversations with God. And today it says, Isaiah said, whose report should I believe? Who, my child, shall believe the great and wondrous things I will accomplish and I will do through you? I have assigned everyone a ministry. Everyone has a purpose. You have waited patiently and diligently for this time and for your assignment. You have done what I asked you to do. You are now ready for what I have been preparing for you in mind, body, and spirit. I want you to work diligently in your ministry. I will instruct you. I will nourish you, and I will give you the orders. You will help them grow until your time is done, and they can move on to another place that I will instruct them and you. My child, I will write the vision and make it plain. That's Conversations with God from Cheryl Mims Williams with Agape Counseling and Training Center. It's such a great journal that she has written that has scripture and some of her journal writings, and it's a great inspirational read. I'm Trey Taylor. Hey, thank you so much again for joining us on a Wellness Wednesday from In It Together SC and the Diabetes Action Council of South Carolina. Until the next time, I wish you peace, abundant blessings, take care, be well, be safe, get your vaccine, and you still need to wear your mask over your nose and under your chin. I'll see you tomorrow.
Coping, find peace of mind to survive through whatever. Coping, learning the way that we thrive all together. Coping, finding out what's real. Coping, we can heal, we can heal, we can heal, we can heal. Coping with stress, coping with strife, bringing hope for success in improving our life. Coping beyond hoping to do more than survive. Ways to live a healthy life. Coping and promoting, learning what you can do. 6 days to a better you. Coping, find peace of mind to survive through whatever. Coping. whatever. Coping, learning the way that we thrive all together. Coping, finding out what's real. Coping, we can heal, we can heal, we can heal, we can heal. Coping with stress, coping with strife, bringing hope for success in improving our life. Coping beyond hoping to do more than survive, ways to live a healthy life. Coping and promoting, learning what you can do. 6 days to a better you. Coping, find peace of mind to survive through whatever. Coping.